Let's begin this show with Delhi. Delhi has eased restrictions amid COVID surge, with the city witnessing increased pollution, a surge in COVID cases and ongoing festival season. Is it the right time to ease these restrictions? Delhi is blaming the recent surge in coronavirus infections in the national capital to a combined effect of the festival season, decrease in temperature and air pollution. Then why is the Delhi government allowing 200 guests in a closed space and probably even more in open spaces in weddings? Also, the buses will now run full capacity. This is quite surprising why the government is taking this decision right now. And Delhi government is giving its own reasons for lifting these restrictions. They say it's not important to restrict the number of passengers in a bus for that matter if they all wear masks.
मैं बता रहा हूँ, अगर मास्क लगा रहे हैं तो खतरनाक नहीं है। आप मास्क नहीं लगा रहे हैं तो मुझे लगता है 20 की संख्या भी खतरनाक है। अगर मास्क नहीं लगाते हैं तो खतरनाक है, मास्क लगाते हैं तो सफी सेफ है। और अभी भी उसके अंदर अनलिमिटेड नहीं अलाउ कर रहे हैं। जो जितनी सीटें हैं सिर्फ उतने ही लोगों को अलाउ किया जा रहा है, तो ज्यादा नहीं है। और दिल्ली में नहीं, पूरे देश में तो सबने अलाउ कर दिया।
जितनी सीटें उतने पैसेंजर रहेंगे, खड़े हुए यात्री बस में नहीं रहेंगे।
जितनी सीटें उतने पैसेंजर्स को अलाउ किया जाएगा।
Now, the question that we are asking is it wise to ease these restrictions in festive seasons, especially if 36% Indians are planning to socialize this festive season? This is according to a survey done by local circles. Now, what exactly is the reason behind this third wave that we are seeing in Delhi now? To talk about that and whether it is wise to ease the restrictions, we have two guests joining us. Dr. Manoj Goyal. He's the Director of Pulmonology in Fortis Memorial Research Institute. He joins us, and also joining us is Sachin Tapadia, who has done this survey for local circles that basically says that Delhiites, or for that matter, all Indians are just waiting to step out to socialize. Dr. Goyal, let me begin with you. You know, we all know that COVID fatigue has set in. It's festive season also. The weather is becoming better. People are just raring to go out of their homes. They just want to go out. Do you think easing of restrictions from the government at this point of time was a good move?
I think the problem is far from over, and as we can see that, the spike is again coming back, and each time the spike comes back, it is a greater or bigger spike. So we have been observing this. And this is the time when, people are more vulnerable to viral infections. When the winter sets in, the pollution sets in, the people tend to become more, infectious. The viral particles tend to stay more in the atmosphere for a longer period of time. They remain suspended there. So, the social distancing, hand washing and masking, these are the three key elements in the prevention of the disease. So that's very important. I don't think this can ever be compromised in the near future.
But if the buses are going to run in full capacity, do you think distancing will happen? Every person is sitting in every seat. There is hardly 2 inches of distance.
Yeah, it's not matching the standard criteria of, this maintaining a distance of 6 feet from each other. It's not, matching that. And plus, bus is a closed environment, especially if it's an AC bus. So, in closed environment, there is a possibly airborne infection. So, right. One has to be very careful.
Absolutely. That's why we are questioning these decisions, whether it's wise or not. Sachin, your survey says that Indians are just waiting to go out in the festive season. And if you ease the restrictions, if you let them travel in the public transport without any distancing, this is like inviting trouble.
No, absolutely, Anjali. This is a recipe for disaster. Given what is happening, given what Delhi has seen in the last, 5-6 days, all above 5,000 daily caseload. People are going out shopping. 2, they are looking at socializing, as our survey suggests, 36% of Indians. And 3rd, you have the pollution. So it's, it's a triple whammy. And, had this, had the government decided that they wanted to do this, they should have waited until the pest pollution was over. Right now is definitely time to, introduce something like this.
Right. They could have waited, as you were saying, but probably it is linked to the festival season. They do not want to restrict movement because economy has taken a setback. If festival season, they continue with the restrictions, then it will take a further setback, what we call the festival economy.
True in some sense, but look, I think we have got to balance here the economic activity along with keeping Delhiites and Indians safe. And I think it's a balance that had to be struck. So therefore, people are finding alternative ways to shop and to do different things. I mean, look at the statistics from yesterday. Yesterday, as of yesterday evening, none of the private hospitals in Delhi have a COVID ICU bed.
That's true.
NDTV carried our survey in early September where we said, 70% Delhiites had to use some kind of connection. Some even had to bribe to get an ICU bed. So at this time, when you have 5,000 plus cases, by opening more things up, by removing some of these restrictions, what if tomorrow you have 10,000 cases and really, no bed at all? How would you manage a scenario like that? And that's the last thing you want in middle of the festival season.
Well, Doctor,
festival will come and go, have Diwali again next year. So it's really time to be cautious rather than, opening more up.
Right, absolutely. Dr. Goel, if restrictions are eased in buses or other public transports, let's say, and if also for weddings, what would you advise to people who are traveling in buses and people who intend to go to these weddings where 200 people are going to be there in one banquet hall?
It's a very difficult call because, see, as I said, 3 elementary precautions, masking, social distancing, and hand washing, and, this hand hygiene. This is extremely important. Nobody should compromise with that. Whatever happens, the festivals may come, the weddings may come, but this is not compromisable. This is a real issue. One has to understand it. This virus continues to be highly infectious. It could be very, very much virulent. It's not in any way seems to be waning in its virulence and its, capacity to infect one person to the other. So, I mean, I don't have anything else to say. Maintain social distancing, wear the mask properly. Proper wearing of the mask is extremely important. Just don't wear it for the sake of that you're wearing a mask. It should be worn properly. And proper hand hygiene. This is very important. That has to be done. No compromise on that.
Right. And probably it's time for people to start thinking about getting those fancy masks made if you're planning to go to a wedding and you don't want to cover your face because you don't want to spoil your outfit. I think you have to find alternatives because this is going to be one of the reasons that cases might spike up. Weddings, festive season, pollution, and we have to be really careful about that. Thank you, both of you, for joining in. Sachin, I'm going to let you go right now. Thank you very much for giving us those inputs from your survey. Dr. Goel, do continue with us because we have some questions that viewers are sending to us and we'd like to ask you those questions so you can answer them. Let's first take the first question which has been sent by Anik from Aligarh.
अनिक अलीगढ़ से मेरा क्वेश्चन है कोविड-19 की वजह से हमें किस प्रकार का खाना अवॉइड करना चाहिए?
Dr. Goel, is there any kind of food that we should avoid is what the boy is asking related to COVID-19?
Not really. I mean, कोई चीज अपना फूड जो आपका नॉर्मल हेल्दी डाइट है उसको आप लीजिए. पर मेरा थोड़ा सा कंसर्न ये है कि कोई भी ऐसी चीज फूड जो कि आपको एलर्जिक रिएक्शन पैदा करे, जैसे खांसी पैदा कर सकता है. कुछ लोग एस्मेटिक होते हैं, इनमें ठंडा पानी पीने से या ठंडी चीज खाने से कॉफ प्रोड्यूस हो जाता है. और आजकल जमाना ऐसा है जिसमें कोई भी खांसी होगी, थोड़ा सा भी फीवर आएगा, सबसे पहले यही उम्मीद होगी, लगेगा कि कहीं कोविड तो नहीं हो गया. इसलिए जो चीजें ठंडी है, जो बहुत तीखी चीजें हैं, हैवी फूड है, उसको आप अवॉइड करिए. बाकी आप नॉर्मल बैलेंस डाइट लेते रहिए, कोई प्रॉब्लम नहीं है.
Right. So there's nothing in particular that you need to avoid, but in fact keep an eye on what you're eating and make sure it's homemade and balanced. Let's take the second question that has been sent to us. Karishma from Indirapuram from the NCR region is sending these questions.
हाय, मेरा नाम करिश्मा रसूकी इंदिरापुरम से. मैं ये जानना चाहती हूँ कि अगर टेस्टिंग पॉजिटिव हो और एसिम्प्टोमेटिक हो तो क्या करना चाहिए?
राइट.
अगर आपका टेस्ट पॉजिटिव है और अगर आप एसिम्प्टोमेटिक हैं तो आपको अपना ध्यान रखना पड़ेगा, अपने सिम्टम्स को बराबर ऑब्जर्व करना पड़ेगा. जो मेन सिम्टम्स है वो फीवर है, कॉफ है, ब्रीथिंग डिफिकल्टी है, चेस्ट पेन और डिजीनेस. ये 5 मोटे मोटे सिम्टम्स जो आपको केयरफुली ऑब्जर्व करने पड़ेंगे. बाकी जो सिम्टम है जैसे कि पेट में दर्द होना, लूज मोशन होना, टेस्ट का चला जाना, सूंघने की शक्ति का कम हो जाना, उनको भी ऑब्जर्व करना पड़ेगा. पर मेन सिम्टम आपका चेस्ट पेन, ब्रीथिंग डिफिकल्टी और एक पल्स ऑक्सीमीटर जो रखिए अपने पास जरूर, जिससे आप अपना ऑक्सीजन चेक करते रहिए. अगर आपका ऑक्सीजन सैचुरेशन 95% से नीचे होता है तो एक कॉज ऑफ वरी हो सकता है. और ये चीज आपको अगर होती है, जो आपके डेट ऑफ टेस्ट से जब पॉजिटिव आता है, या आपका लास्ट कॉन्टैक्ट जिस बंदे से हुआ है और वो नॉन पॉजिटिव केस रहा है, तो उससे कम 17 डेज तक आपको ऑब्जर्व करना पड़ेगा और आपको सेल्फ क्वारंटीन में रहना पड़ेगा.
Right, absolutely. You cannot let your guard down just because you're asymptomatic. We have seen cases becoming symptomatic later. Well, it's time for a short break right now. On the other side, an expert from South Africa joins us and tells us why exactly is South Africa able to control the COVID in a better way. But before that, let's take a quick break. Welcome back, and now we bring you some special news from South Africa. South Africa has seen relative success in terms of keeping the pandemic in check. If you compare it to the record of most of the countries in Europe and Americas, it seems that the country's hard shutdown worked, and the South Africa is still to see a second surge that could be classified as the second wave. Even Dr. Anthony Fauci, who's the director of National Institute of Allergy and Infectious Diseases in US, the premier authority on COVID, has admitted that South Africa's response was way better than US. And you can see that there in the curve of deaths as well as daily cases that South Africa has managed to control its numbers. And joining us right now is Dr. Salim Abdool Karim. He's director of CAPRISA, which is Center for the AIDS Program of Research in South Africa. Thank you very much, Dr. Karim, for speaking with NDTV. What is behind the success of South Africa?
Good morning, Anjali, and good morning to all of the viewers. I think what was quite important was that when we had our first case on the 5th of March, for the first 2 to 3 weeks, our epidemic was growing rapidly. It was doubling every 2 days. We were on track to have an epidemic as severe as that in the UK. But because the government took very early action, within 10 days of the first case, before we even had our first death, the government declared a state of disaster, closed the schools, stopped international travel, and then within a few days later instituted a lockdown. So what happened as a result is that the community transmission of the virus drastically slowed, from doubling every 2 days to doubling every 15 days. And that slowing down of the transmission at a community level, the deployment of community healthcare workers to screen people in the community, all of that led to a slowing down. So our peak occurred in July instead of April. And because it occurred in July, we had our field hospital, for example, the Cape Town Convention Center had an 800-bed hospital with oxygen in every bed. So we were better prepared, ready to deal with this problem. And so our epidemic did not seem as severe.
Right. Also, if you look at your daily death numbers, that has also come down. But we do see a surge now happening. There are a few areas that we are seeing a little bit of a jump in the numbers. Is this worrying for the country? And also, are the hospitals ready in case of a second wave?
So when we look at our epidemic since the middle of July, when we had our peak, within about a month, we came down to a trough level that has seen transmission in the region of around 2 to 3 cases per 100,000 per day. That's below the threshold of 5 that we've been trying to maintain. So below 5, we regard that as low transmission. And we've been in low transmission now for quite a while. What has happened over the last 2 weeks is that we have started seeing a few outbreaks occurring. And this was expected. We have always known that the virus is still with us. And what has been and what seems to be a major concern that's driving some of these outbreaks is that the university students and the high school students have been having parties and functions at taverns and at nightclubs. And those seem to have led to a spread of the virus. We've had at the University of Fort Hare a huge outbreak because of 2 parties that they had, an outbreak in Cape Town at one of the clubs there. So that's been our concern right now, that we are seeing these outbreaks. Fortunately, most of these outbreaks are being rapidly controlled. We've got quite clear measures in place that are hopefully keeping this under check. But we are no longer talking about some kind of overarching action. If we take action now, it's based on information, it's highly localized, it's dealing with the problem where it exists. And that's been our new approach to dealing with this virus.
Right. So these new surges are follies of youth, and it's understandably difficult to control them. I mean, that we are seeing that in the country. But Dr. Karim, came in about the virus may have infected nearly a fifth of Africa. Do you think this could also be that you think, or do you think does not contribute to community protection as such?
So one of the things we are very keen to know is what proportion of South Africans have been virus and have currently underway. Huge survey going house to house. There's about 1,000 people being visited. So that will give us an accurate measure on the ground what proportion of South Africans have been exposed. In the meantime, some small studies have been done of convenient samples like pregnant women, HIV patients, and those have shown positivity rates ranging from around 20% to up to about 37%. And those, you can't extrapolate that to the entire country. It would be inappropriate to do that. But they give us some indication that it looks like we've had pretty high exposure in some segments of our population. The extent to that is not known. So does that mean we've got herd immunity? Does that mean we are protected? We're not going to get a second wave? Unfortunately not. If we look at the experiences across the globe, it simply does not work that way. If you look, for example, at Manaus in Brazil, where they had a very high exposure level, 66% of the people in Manaus in Brazil were infected with the virus. They claimed prematurely, oh, we've got herd immunity. There are excellent publications on this claiming herd immunity. However, Manaus is currently in a second surge, in the midst of a second wave. So even at 66% of the people in Manaus having antibodies, they are still seeing a second surge. So even at 20% or 30% or even 40%, I doubt we will have the protection of antibodies to prevent a second surge. What it does suggest that if we do have a second surge, it may be less severe than the first surge, because some people may have continuing immunity. And our big concern is that we don't know yet how long immunity lasts. Absolutely. We don't yet understand how long we can expect people who've had the first infection to be protected from a second infection.
Absolutely. Doctor, before I let you go, a quick tip for countries which are still grappling with either the first wave, the second wave, the third wave, or like US, multiple waves. What would you suggest to them? What is the way to keep it in control?
I think there's really three things to do. The first is we just have to continue promoting the health measures of mask wearing and social distancing, but to do so consistently. We can't be doing something and saying something else. We have to do the two together. We have to show that our leaders are doing what they are recommending everyone else to do. The second is we've really got to use a combination of compulsory restrictions in a very careful way together with voluntary approaches so that the combinations can help us keep the virus in check. And thirdly, we've really got to get to a position where we understand as individuals that our actions impact everyone else, that are mutually interdependent, that I can never be safe until you are safe. You can't be safe until I am safe.
Thank you very much, Doctor, for joining in. As you just heard him say, we have to send out a strong message and a consistent message as far as masks are. With this, we hope that you are also wearing a mask, and we're going to bid you goodbye. But we from Monday to Friday, meet you tomorrow.